Hello, everybody, and welcome. My name is Tamsin Rose, and I have the great pleasure to be your moderator this afternoon. And welcome to this session, which is part of the European Fertility Week. And we have the hashtag Challenge the Odds, which is specifically related to our event this week, because the focus of this year's event is male infertility, Challenge the Odds. And over the next couple of hours, we're going to be exploring this issue from a number of different areas and making sure that at the end, I hope you will all be more aware of it and more ready to help address some of the issues. So I'm delighted to introduce our host and our co-host who will be opening our event, and that's Predrag Matic, a member of European Parliament and strong supporter for European Fertility Week from Croatia, and Satu Rautakallio-Hokkanen, who's the chair of Fertility Europe from the Executive Committee. Fred, please, the floor is yours.
Thank you, Tamsin. Dear colleagues, dear experts, welcome to the Fertility Europe event, where I will be discussing the topic of male infertility. I'm very glad to be hosting this event during this year European Fertility Week, and once again congratulate our colleagues from Fertility Europe for organizing this and putting this extremely important topic on the agenda. I will start by saying that I'm looking forward to hearing our experts' contributions and input. As much as we are all aware of the importance of full access to fertility treatments, which are focused today on male infertility, there is much to be learned. In my resolution on sexual reproductive health and rights, which was adopted in June this year, we dedicated a full chapter to fertility treatments, infertility and subfertility. It is indeed a growing problem across the European Union, and we were very aware of the need to politically react to it and draw attention to ensuring comprehensive and non-discriminatory access to fertility treatments. On the topic of male infertility, I can tell you that I have different encounters with that, but by the far most shocking derives from my experience when I was in a war prison in Serbia, where many of my fellow prisoners were mistreated and beaten in the genital area, and as a result left infertile. This was extremely shocking for all of us there, and it left a permanent mark on our lives. Those men never had a chance to get proper treatment, to talk about it, or to somehow process what had happened to them. That is why I'm very thankful that we are opening a social discussion on this issue. I thank all of you and look forward to hearing your contributions. Thank you.
Thank you very much, Fred, and again for raising this very challenging issue. And as you say, many men don't have the opportunity to get access to treatment or a chance to explore and express what some of their issues are. And that's why we're having this conversation now. Satu, let me invite you to take the floor.
Thank you, Tamsin, and thank you, Fred. On behalf of Fertility Europe, I wish you all welcome to this online event about raising fertility awareness and access to fertility care, and especially this time about male infertility and fertility. Fertility Europe has done the advocacy work on behalf of our European member associations for 12 years now, and the first European Fertility Week was in 2016. We strongly believe and support that everyone has the right to try to have a child, and if there is a need for medical help and psychological support, it is the obligation of all European countries to offer those to their citizens. We have acknowledged that men are often left aside when the discussion about infertility and fertility is raised. Therefore, we wanted to make it the main subject of this year's European Fertility Week. We want to make men and their hopes, needs, and fears visible. We need this discussion to raise awareness. We need to encourage men to talk about their reproductive health and feelings related to it. This event and the week is now really starting the conversation with the professionals, the general public, and of course, men themselves. Thank you.
Thank you very much, Satu. And just to get a context and an introduction to what this topic means in terms of people's experience, we're now going to have a short video from Tom Webb, who is the director of the Easy Bit, but which explores the experience of male infertility.
When my wife and I were going through fertility treatment, we had a lot of love and support, and people really did care, but they didn't really understand. There was a particular lack of understanding about what it was like for men to go through fertility treatment. And it was one of the main driving reasons that I wanted to make the documentary The Easy Bit, was because I wanted to show the world that men do experience this at a very deep emotional level, and it affects them greatly. And back when we were going through it, there wasn't really a lot of stuff like that out there. Thankfully today, there are documentaries, there are podcasts, there are Instagram accounts, there are Facebook groups, and there's all sorts of manner of places where men can go and find people that have experience and people that understand. When I think about the positives that came out of us going through fertility treatment, clearly the number one thing would be our daughter, who I think is the greatest achievement of my life and my wife's life, regardless of the fertility treatment. One of the other things I'm really proud of is that even at our darkest moment, when we were starting to think that we were going to be childless, not by choice, I couldn't accept that there couldn't be something positive coming out of what we'd been through. And that's what led me to make the documentary The Easy Bit. The best advice I can give to people going through fertility treatment is find someone to talk to, find someone who understands, that will listen, find somebody that you can vent to in your darkest moments, find somebody that you know you can call on whenever you need them. Talking about it helps. It helps a lot. And I don't think I fully appreciated that until well after our fertility journey.
Thank you. So we had some messages there from Tom, and it's obviously just an introduction to his documentary that he's delivered. But he made the point that men feel this at a very deeply emotional and physical level. And he had some advice, and his advice was find people to talk to, find people who understand, who can appreciate what you're going through. So we'd now like to ask you, the audience, a question related to that issue. The advice of Tom is to find people who understand it, to whom you can talk, who can share your experiences. So let's ask the question. And here we're going to launch a poll. How many men having treatment with experienced infertility know about a male infertility support group in their choice, in their country? So do you think it's 5%? Do you think it's 16%? Do you think it's 31% or 54%? So do you feel that very few men who have infertility, so maybe only 5%, know that there might be a male infertility support group in their country? Or do you think that quite a lot of them will have followed Tom's advice and will have found a group? So maybe you think that more than half, 54%, have found a group that would support them, that would give them advice and help and emotional support through their journey. So we're going to leave that open for another few seconds, and after we finish this poll, we're going to hear from somebody who's carried out a survey, so we'll hear what he found in his survey. But first of all, we want to get a sense from you. How many men do you think who experience infertility know about, let alone access? First, you have to know that it might be a male infertility support group, and then the next thing is you actually have to make contact to do something. So this is the question we're asking: how many men who've experienced infertility know about a male infertility support group in their country? Let's now close that vote and let's see the results. What did you think was the answer? What proportion of men? Now, the people that we asked you, more than half of you thought that very few men, that only 5% would actually know that there's a male infertility support in their country. 45% of you thought that actually maybe a few more, 16, so maybe 1 in 8 would know that there would be a male fertility support group that they would know in their country they could deal with. So thank you for participating. But clearly your view is that if there is a male infertility support group in somebody's country, very few men who experience infertility know about it, let alone access to it. So let's find out if those results match with a survey that our next speaker carried out. So I'm delighted to introduce Christopher de Jong, who is from the Male Reproductive Health Initiative, and he's carried out a global male infertility questionnaire. But before I do that, just let me show you how we're going to run this afternoon. So Christopher is going to give a presentation, and then we're going to have a panel conversation. We'll take a short 5-minute break, comfort break, bio break, get up, move around. We'll have a second panel looking at how we get more equitable access, and then we'll be closing at 3 o'clock. Now, in both of our panel discussions, you, the audience, have an opportunity to interact with us. So if you look at the bottom of your screen, you will see there's a Q&A function. So if you've got a question or something you'd like to bring up or ask the panelists to comment on, please use the Q&A function at the bottom of your screen. That's how you engage with us. Okay. So now let me pass the floor to Christopher. You saw here when we asked our audience, they thought that very few men, either 5% or 16%, knew that there might be a male infertility support group in their country. How accurate is our group compared to the men that you surveyed?
Next slide, please. Well, we'll get to the answer that you're requesting in just a couple slides, but first it's important for me to thank sincerely Fertility Europe for extending the invitation for me to be here today. I'm a representative from the Male Reproductive Health Initiative, and Fertility Europe has been a strong supporter of our mission, and we're very, very grateful. I'd also like to thank the participants for choosing to take the time today to participate in this very important topic. So as part of the Male Reproductive Health Initiative, we drafted a questionnaire that was circulated globally to ask questions regarding male attitudes towards infertility. My colleague, Satu, who you've just seen a moment ago, my longtime friend and colleague, Christopher Barrett, University of Dundee, Steve Gallatley, and then the MRHI working group. And you'll note at the bottom is a web link. And that web link will take you to participate in the questionnaire. We urge your participation and thank you. Next slide, please. So the questions that made up the questionnaire were really quite simple, yet these questions have never really been addressed in any publication, especially on a global level. So while there are only essentially 8 questions, the answers to these questions remained unknown until now. First of all, we surveyed nationality, age group, what motivated men to seek medical help for their infertility, how men view their infertility, how likely are they to talk about their infertility, and this goes back to Tom Webb's presentation a moment ago. And then the big question, is there a male infertility support group in your country? From where have you primarily searched for information about male infertility, and has an infertility specialist recommended herbal supplements as a treatment? This last question being a bit controversial. Next slide, please. So this figure represents the global responses. And what you see highlighted in the panel on the left is that 93% of all respondents came from Europe. The remainder is very low for other areas of the globe, and we're hoping that those numbers will increase by additional participation. The remainder of the slides will focus on Europe and the subregions. before we go to the next slide, you'll see that the vast majority of individuals are in the 30 to 39 years of age group. The next group is the 40 to 49. Could we go back, please? The 40 to 49 years of age group. And I was surprised that the 20 to 29-year-olds is so low at 9%. Now the next slide, please. So, what motivated men to seek medical help for their infertility? And we have this broken down into self-motivated in blue, partner-motivated in red, mutual motivation in green, and then unknown. And I think starkly, at least to me, is self-motivation is very low. It's about 12 to 15%. The partner tends to figure in more prominently, and then there is a united front for men to seek help for their infertility, and that dominates by both motivating medical help. Next slide, please. This is an important question. How do you view your infertility? In the blue, men feel positive. In the red, negative. The green, conflicted. Conflicted means that they answered that they have a positive feeling about it, but yet they also feel, for example, ashamed, embarrassed, and we categorize those as more negative feelings, and then unknown. And I think what's interesting here is that essentially half the men view their infertility positively. However, there is a significant percentage of both of combined negative and conflicted. And this group is one that needs additional support. Next slide, please. So what that means then, and this harkens back to Tom Webb's presentation, how likely are you to talk with others about your infertility? Others meaning friends, relatives. So you might imagine those people being more accessible in conversation about the topic. If you look though, there's some regional differences. In Southern and Northern Europe, men are more likely, about half of them are likely to talk with friends or relatives. In contrast, in Western and Eastern Europe, the percentage is lower, approaching about 30%. A large group is that there is somewhat likely to talk, and then the smaller group cumulatively is very likely. So following along publications, men really aren't engaging with others about how they feel about their infertility. Next slide, please. And here's the million-dollar question. The primary responses from the poll indicated 16% or less, and that falls exactly to what our respondents in the survey reported. Was about 16% responded that they knew of a male infertility support group in their country. That's too low. Somehow, some way, social media, talking with friends, relatives, co-workers, needs to expand the awareness of men to be able to seek support so that they can feel better and feel as though they're part of a larger group in their male infertility search. Next slide, please. So where do men primarily search? First is their own doctor, but then figuring in largely is their partner's doctor. And this slide then reflects back to there being dual motivation or mutual motivation for seeking infertility help. For younger men in the 20 to 29 years of age group, there was a greater tendency to use social media. Next slide, please. And here's a bit of a controversial question. Has an infertility specialist recommended herbal supplements to you as a treatment? Again, there's some variation here with Southern and Eastern Europe having a large number of respondents where the physician has recommended treatment using herbal supplements. Western and Northern Europe, much less. And then the next slide, please. So in conclusion, the key takeaways of male attitudes towards infertility are that men 20 to 29 years old are more self-motivated to seek medical help for infertility. Men 20 to 39 years old are more likely to talk with others about their infertility. A big red flag, most men are unaware of support groups for their infertility. Men are more likely to receive infertility information from their partner's doctor. Men have to motivate themselves more greatly to visit their own doctor so that they can gain information, for example, from their urologist, as opposed to an obstetrician gynecologist. Doctors recommended herbal supplements to treat infertility in about 50% of all men. In closing, I'd like to point out again the link at the bottom of this slide. We ask, please participate. We need to know how you feel. Thank you very much for your attention today. Have a wonderful meeting today.
Thank you for Christopher, and it's interesting to see the correlation between what our audience thought was the case in terms of the number of men who knew about a male infertility support group and the numbers that you found in your survey. And as you mentioned, this survey is open until the end of the year, and we strongly encourage people to take the link that we've put in the chat. So you'll find in the chat, which is on the bottom of your screen, you'll see the link. Now this survey exists in a number of different languages. So once you click on the link, you'll be able to answer the question in different languages. And please send it to friends, colleagues, any medical professionals that you know. The more data we can gather, the more the situation becomes more visible. If it's visible, it can be changed and improved. So that's the clear message behind it. And as Christopher said, this is the first time that this data has started to be collected. So now I'm going to bring in a panel discussion, and we have a number of different experts who are going to open up this question that we've been talking about. Do we have sufficient awareness of male fertility and infertility issues? And therefore, can we address the gaps in fertility care? And the first person I'd like to introduce is Benedikt Schwan, who's a science journalist and author and an advocate for male health. And he's going to be talking about male infertility as the invisible pandemic. Benedikt, let me invite you to first speak.
Yeah, hey guys. I'm very happy to be able to address this very interesting panel and your fabulous organization. I myself am a science and technology journalist and also an author. I did write a book about my personal journey through male infertility, but it's also, this is it. It's also a book that describes the current situation concerning male infertility, because I didn't know a lot about it before I was a victim of it myself. I learned about my infertility when I was 41 years old. And I call it a hidden pandemic because it's a problem that's much larger and concerns many more people we see nowadays. And we don't talk about it. We don't have a lot of science information on it. We don't research it. Most men only learn about it when it's too late. Why do I say it's a pandemic? Because it's all over the Western world. We don't have a lot of data from the Southern Hemisphere. But in the Northern Hemisphere, we know that since the 70s, sperm concentration has gone down about half. Besides that, we don't really collect any data. We don't know how many male persons are infertile because they only see it when it's too late. And the thing that struck me most in my research for my book and also my personal journey was that people think it's a problem that goes away, or I'm not concerned myself. And that's absolutely not true, because if you ask around in your friend circle, in your family, you will absolutely find persons who have problems with fertility. And in a lot of cases, males are at least part of the problem. Since we don't really know what's going on there and still feel that males are only like a really small part in fertility, we don't look at it absolutely enough. And the consequences of infertility for society is just huge. Currently in Europe and other Western countries, we sort of compensate our declining birth rates by getting more immigration, which is fine, which is nice, which seems to be working. But as soon as we get immigration, the birth rate drops again. So it's basically a zero-sum game. We need to know why male infertility goes down, what is behind it. We don't know currently. And we have to really see that society reacts to it, that politicians see the problem, that males are able to talk about it because they're very scared about it, and don't talk about it and keep it in the back of their head until it hits them, basically. And we really need to see that when we're not able to procreate anymore, society stops. It's what's happening. We see it in highly sophisticated countries like Japan, where we have a declining birth rate combined with male and female infertility. And it's basically starting to be a society that's dying. And the same thing could be happening in Europe, could be happening in North America. And as I like to quote Greta Thunberg, I want you to panic because it's something to panic about. And we don't do it currently, and it shouldn't be too late. We really need to do something. Thank you.
Thank you very much, Benedikt. And clearly it's a message, that a call for action and a call for people to notice things, to step up and be aware of it. So now let me bring in the next member of our panel, and that's Klaudija Kordic, a representative of the Patient Association RODA from Croatia. And she's going to explore with us the issue of the silent shame of male infertility. Klaudija, please go ahead.
Hello, as I already said, my name is Klaudija Kordic. I'm a former infertility patient, and as such, I'm really happy to be the patient's voice here today. I would like to show how the patients feel and see male infertility, and how we can all be of kind of a help. It might be surprising, but it's still kind of uncommon for people affected to talk openly about infertility in general. It is still a taboo, as people simply do not want to show other people their intimate problems. And even myself, 10, 15 years ago, I was not willing to talk about infertility issues. And this for several reasons. First, I did not want to show my weakest side to the whole world. I really tried to avoid questions like, are there any news? Or how was the last treatment? Especially being aware that it could take a while until treatment might or might not end up in pregnancy. For many people, still, silence is a comfort zone, is a kind of self-protection. On the other side, infertility is still too often understood as the female problem. Infertility or barrenness as the incapability of producing offspring, especially used for females, like barren woman. Have you ever heard of a barren man in this context? I have not. Infertility is simply struck with female infertility and is changing very, very slowly. This makes it even more difficult for men to start the conversation. Next slide, please. Okay. But what are the reasons for male infertility not being talked about? In general, men tend to open less often and are reluctant to talk about problems. Sperm analysis, as such, comes often very late in the wide range of exams while looking for the cause of infertility, although sperm analysis is quite cheap and non-invasive. there are still men who refuse to visit a fertility specialist and to do semen analysis as such. Is this a fear of being the one who is guilty? Is this the fear of failing? Maybe. Male infertility is wrongly often connected with impotence, and this might also be a reason for men not to talk about infertility. We sometimes in our association hear from women undergoing treatment and they say, luckily I'm the reason we have to go for IVF. He would not be able to cope with this otherwise. Next slide, please. How does male infertility look like in real life? This is a testimonial we received from a woman who, and we do hear such experiences quite often, saying that when he got his diagnosis, he was in a bad situation for a very long time, not willing to talk to me at all. Although I asked, I offered support, I simply could not reach out to him. He shut himself away from me and he seemed very depressed. Even now, having had fertility treatments for more than 3 years now, he's not able to talk about it. He's hiding the diagnosis and even the treatments from friends and his parents. We simply pretend we're okay without children. Next slide, please. And here goes another testimonial we were approached with from a female patient undergoing treatment, saying, my grandmother told me to find another man for this and to try to solve this problem the other way. She even told me that my husband does not have to know. And this way, she told me, is the way some women from her village solved their fertility issues decades ago and eventually became parents. We can only imagine how humiliating this can be for both partners and why depression is so common with male infertility. Next slide, please. But what can we do to help? For the media, well, infertility is really very common. It's very likely that one of your friends or relatives is affected. Try to unmask, try to write, try to spread the word. Talking and writing about infertility can help to make taboos disappear and to weaken the stigma. For friends and family, simply show support. Do not feel pity. Don't make jokes. Just be there and listen. Inform yourself so that you can understand what they are talking about. For policymakers, be aware of the fact that 1 in 6 couples and 1 in 6 people in Europe face infertility. It's a huge and still rising number, in particular male infertility. We all have to make sure that people have access to accurate information about fertility from the youngest age, that they have access to fertility treatments if they need and want it. And for patients associations, make space for men, be more inclusive. And as a last word, infertility is a disease, but there is efficient treatment. So let us work together to offer necessary support and to secure access to safe treatments. And all this without exception throughout Europe. Thank you.
Thank you very much, Klaudija, and again for sharing this very powerful testimony from families and both men and women undergoing treatment and the impact, this emotional impact, this psychological impact as well. Now let's bring in the final member of the panel, and that's Mariana Martins, professor at the University of Porto from the Faculty of Psychology and Education. And she's going to address, is there a place for men in medically assisted reproduction, and why do we need to understand better the male experience? Mariana, go ahead.
Thank you, Tamsin. Hello, everyone. I would like to thank Fertility Europe for this opportunity and congratulate this association for their excellent work. We are seeing you growing and driven, and the role of patients with professionals is very important, and we are very happy to be all here together. So we are focusing on the importance of including men, and I want to start by saying that this is a generalized problem in health access. Okay, so when we are talking about prevention of health risk factors, in general, when it comes to adopt what we would say would be good health habits, the strongest predictor for it is being a female. So this is over socioeconomic factors, for example. And to corroborate this, we have several indicators that men do not have checkups or visit their GPs as often, for example. This is, of course, also true for mental health. So men do not only not seek specialized support, but also They do not actively seek support or share emotions with their social networks, whether we're talking about family or friends or colleagues. And this alone makes this population quite vulnerable. So we have, for example, in suicide rates, we have a lot more men than women. And we have talked about this before, of course. It is very important to talk to someone, but it's also important to choose the people you are talking to. So next slide, please. Within reproductive health, as you can easily imagine, the secondary place is much more reinforced by the fact that women have been expected to be the main responsible partners for their reproductive choices. This is, of course, related also to sexual education and particularly contraception, the prevention of STDs. Of course, we are aware that the cost of reproduction is higher for women, but it is also this cost and gender equality which has been massively increasing the number of couples that do not make this transition to the second child. So within infertility, we're talking a lot about the first child, but also there's been a decrease in all over Europe for the second child. And this has been a big problem in Europe. We have already been a little bit through these numbers. We know that within fertility treatments, men seem to be gaining importance not only as diagnosed techniques advance. So we know now that men are responsible for 30 or 40% of the diagnosis and 20% as the sole cause. And we need to be aware that there are consequences in the postponement of their childbearing decision. Age, for example, we've been only discovering now that there are several physical and neurological outcomes for the resulting child with men age, not only women's age. So other factors as smoking, alcohol, drugs, men experience infertility different. So I think it is also important to mention that there are a lot of European countries, such as mine, for example, where access to treatment in public centers is guaranteed to single women, lesbian couples, but not to single men or gay couples due to surrogacy. So while there are, of course, other serious issues to consider, this is also placing men in second place. It is thus important to take into account that men are experiencing trouble conceiving and go through treatment. When they go to treatment, they experience it differently. This is obvious from the first appointment. Patient charts have the women's name, the female partner's name, and not the couple's name. A lot of times we don't even know the male name. So I want to talk a little bit about this from the psychological point of view. Next slide, please. We know that in general, men have a higher tendency to suppress their emotions. This is not different in going to treatments. It is the female body that is mainly affected and goes through all the injections, hormonal treatments. This is repeated throughout the process. So there's an aggravated feeling that they are secondary to this decision-making of entering treatment and continuing to pursue it also. This is relevant, as you know, that adherence to at least three treatment cycles is important and could be optimal. So men do reveal on average better psychological adaptation than women on psychological assessments. That's true, but it is also true that these assessments are a lot of times biased by a female perspective. So we are not even sure if we are assessing these feelings the right way. Men also take the role of being the central stone that supports the couple through the emotional roller coaster, to be able to balance the anxiety of their partners, to support their partners. In some cases, this can be a paradoxical strategy because we see often in the clinic, the female partner feels that she's the sole responsible, she desires more the childbearing. And that maybe this is not as important to their partners. And this is just not true, as we have seen from Tom's view. So what we know is that after a first consultation, and particularly after failed treatment, the levels of stress, depression, and sexual functioning do decrease in the first year. And it takes at least another year to recuperate to baseline levels. Sexuality is particularly important to refer when it comes to the couple dynamics, because men tend to be viewed as the partner who only has to spend 5 minutes in a room and can wait and relax. So that's the easy bit that Tom was talking about. But these are embarrassing procedures, okay? So we still can do a lot to improve it into a more patient-centered care perspective. Additionally, shifting from recreative to procreative sex tends to have a toll on men's mental health as they let go of the role of taking the initiative. So it's the female partner now that knows when they're ovulating, that takes the initiative, that affects sexual desire and sexual functioning in the long term. So that's what I had to say for today. Thank you very much for having me.
Thank you very much, Mariana. And it's a really wonderful input from each of our panel members. And I'm now going to bring in some input from the audience, because thank you, we've had a number of questions already submitted. And if you also would like to share your questions or comments, then please put it in the Q&A function. So a couple of questions already to members of our panel. And if I could see the members of the panel with their cameras on now to join me. We have a couple of questions. Ben, a very simple one. We had a question that said, did you get engaged in a patient support group? We've heard how important it is. You've written a whole book about your experience. Did you participate in a support group? And then maybe you might like to pick up on the second question, that's, how did you overcome shame and stigma if you felt it?
Well, I have to admit that basically writing the book was my personal support group. I did sort of like make it my mission to find out more about the topic. And since I'm working as a journalist, this is basically my main occupation, to find out stuff. So that was basically the way to go. I have to admit that here in Germany, there's no big support groups that are targeting men. I personally didn't find any in my research. What's happening is basically you can get help from specialist psychologists. There are some groups I found out in the wake of writing the book. But in the end, it was for me personally basically to find out stuff. And then I still haven't really moved on from it. I still go to my psychologist, so I still work on it, but I personally didn't participate in self-help groups. But we again have the problem that there are not many that are targeted directly for males, besides some Facebook groups and stuff like that. Concerning shame and regret and stuff like this, I'm still working on it. What I learned was when I started working on the book and also promoting it after it came out last year, I felt that I'm able to talk about it more and to be able to sort of leave that a bit behind me, because I know so many other people are also victims of infertility. And in the male sector, we just need to speak up. That's the main important thing to do. And I guess because we don't speak up, there's not enough science, there's not enough information out there. We don't tell young people, young men to get their sperm quality tested. So we really need to talk about it, and then we don't need to feel shame, in my opinion. But again, I mean, I'm a bit of a special case because I'm in the media and I know how to talk about stuff. But I know a lot of men who don't want to talk about it, and that's what's making it even worse.
Thank you, Benedikt. Klaudija, let me ask you, got a question here. Is there a group for men in your country? And if not, why not?
There is no specialized group for men. And the reason for it, I think that one of the reasons is, and this is part of the guilt of my association, is that we didn't open the doors large enough for men. We so far have not supported them, asked them to be part of it. We know that they are reluctant to talk about it. We are quite aware of it, but I think our activities were absolutely directed to the part which is willing to talk, to show, to interact. and these are the females. But on the other side, I'm from southern or southeast Europe, so we are the part, and Christopher, I think you will kind of see that this is true, and this is part of your questionnaire. So we are. So the man showed that even in the questionnaire, they kind of feel okay with their infertility, but they don't talk. So simply they don't talk. It's a thing of tradition, I think, in Croatia and in similar countries, that you simply don't, it doesn't exist. Male infertility simply doesn't exist, full stop. But I think we have to speak out, we have to get louder, and it will get kind of, not normal, but it will get the taboos, it will break taboos, and it will destigmatize, I think, at least, and I hope so. Yeah. So.
Thank you. We've got a couple of questions about the role of the medical specialist and their gender. And I think, Mariana, I'll ask you to pick up on that. And then, Christopher, I'm going to come to you to some of the questions about education, how we teach more than just contraception, and how, you know, people get to learn about these things. So, Mariana, let's just first pick up on this area that, you know, if people first find out that there is a problem with male infertility, it's often as a result of fertility treatment that's being led by an obstetrician or sort of a female practice. Is gender an issue? How much of it is an issue that often many of those professionals will be women and the patient is male? What role does this play in? Even though there are, and we'll hear in the next panel, andrologists and people who specialize in male health, that's not often the route that men find out that there is a problem.
I also think it is very, very related to education. So the problem is that you are taught that reproduction is the responsibility of women. Young girls are taught that, and young men too. And if you ask young people, we have done that recently, what's the probability of conceiving in 25-year-old with a 25-year-old woman ovulating? The answer is 83% they give, when in fact it is 30% maybe. So there's a huge gap in there. Over a year, of course, the probability of getting pregnant is much higher, but I think that you are, all your life, you are taught in school that getting pregnant is so easy and you just don't have to do it. And then it's just leaving your contraceptions when you want to. So Fertility Europe is doing a great work now on this. And they are having a project also on how to include family planning within family planning. You know, there's a section called family planning, but it is how not to get a family, mainly. I mean, in most Southern Europe countries, it is to get contraceptives. You go to the family planning consultation to get contraceptives. I mean, and no one asks you, when do you want to build your family? So I think that women, of course, they have their annual checkups, and that's easier, right? So with your obstetrician, and it's easier maybe to start that, but also we need to educate obstetricians and gynecologists and GPs that they need to, when it is to refer, the time to refer to a fertility specialist, and that you don't treat women alone. I mean, I think that's the issue.
Thanks. Chris, can I bring you in on some of these issues? And we've got more of them coming up in the question and answer session now about education. Mariana has explained to us that we have this general perception, and this is what we teach children, that as they go through school, their main goal in life is not to get accidentally pregnant or not to pass on a sexually transmitted disease. And that's more or less it. It's assumed that once you're no longer trying to do those two things, then everything else is just automatically going to function. And we just don't have enough broad education for people to understand some of these issues. And maybe we should be thinking that if young women are increasingly told, you know, they should be keeping an eye on their fertility, should we do the same for men? Should there be a fertility MOT check for people entering their early 20s. How do we deal with this?
I think it's really a bit like an onion with layers, and there are a lot of layers as it presents to the question, which is seemingly simple, but it's not. So in the adolescent years, yes, the boys and girls are hearing about how to prevent pregnancy, how to prevent STDs, because the assumption is it's so easy to get pregnant. We know that's not the case because those young people become adults. They don't suddenly typically become infertile. So part of the difficulty is when the young boy, man, leaves school to go off to university or whatever, he loses the person who is the driver for him to go to the doctor, his mother, typically. I'm making a generalization here, okay? Men are not typically health seekers. They more typically seek health care if they have an acute problem, like they broke a leg. They aren't going to go in for annual exams. The literature supports this. And this really, we need to take a strong focus on this, because the primary ages for testicular cancer are from about 18 to 35. Yet the men are absent. Men don't know that they can do a self-examination to check for nodules and things like that on their testicles. So men could learn a lot from women who are much better at health seeking, go more regularly. Also, there's more and more information where there's a link between reproductive health and somatic health. So men with metabolic disease, cardiovascular disease, these things are being missed opportunities for diagnosis because men are remaining absent from healthcare. So to go back to the beginning of your question, education needs to fortify, for example, what I just said about somatic health, reproductive health. There needs to be greater awareness about environmental issues, that heavy drinking doesn't help anything. And these need to become more social policies. People should discuss these more openly, and there be greater awareness about support groups. Did that answer your question?
Yes, thank you. I mean, you mentioned that it's like opening up an onion, and somebody's put that in the Q&A, that the problems are at so many different levels. There's daily lifestyles, there's awareness and education. We've got a specific question for Mariana, which says, great data from the survey, but what practical steps can we take to address the gaps presented, such as education? What should be our top priority? What's the first thing to fix in your view?
Well, I think that we have to consider different strategies, maybe for men and women. Men are more focused on the practical, on they have great skills, such as calm in the face of crisis, for example, okay? And women have skills that are maybe more prone to these preventable issues or health issues. And they also like to share much more than men. So I wouldn't say, please bring men to the psychologist. They hate me sometimes. They don't like to come, but I would say that, and I also wouldn't say, because it can be, as I said, paradoxical, talk to everyone, say to everyone that you're infertile, because your fellow men won't understand that also, or they would understand, but they don't know how to offer you support. And then you feel that you're not supported. So education is really, again, here as the massive cloud that we are all have to step under, I think. And for practical things, I would say information. So maybe we are still at that level, and men do not have enough information on what it is, what infertility is, how they can be supported, and where they can be checked. I saw here a very, very good question also from our audience of different men's specialties, you know, andrologists, urologists. So where do you go? I mean, this information has to be available, and we are the ones maybe responsible to give it.
Thank you, Mariana. And I saw several members of my panel nodding, and we've just got another 3 minutes left on this panel. So let me ask any of the panel members if you'd like to leave a closing comment on this conversation where we're looking at awareness and understanding both of male infertility and of the range of options that are out there. Is there anyone who'd like to make a final message or comment? Please go ahead. Klaudija.
Maybe myself, you know, that after all discussing, and now we have here quite a wide range of specialists and different professions, and this is exactly what it is about. This is not one profession which has to do something. This is multi-level, and as soon as we recognize this issue, as Benedikt put it, as a pandemic, that second we will together, but only together we can act. I think this is something which has to be priority, at least top 5 within the European Parliament, for example, and then we can have it solved during the next, let's say, decade, not earlier.
Thank you, Benedikt, and then I'll come to you, Christopher.
Yeah, I would totally support that argument. I mean, the thing is, we basically don't see it. It's like running into a tunnel without knowing that a train is coming. I mean, it's just insane. And if you talk about people, especially males, but also females who are confronted with infertility, you see the shame, you see the sadness, but what you also see is like the end of our society in a way, because when we don't have any children, there's no society left. And how this cannot be like a top 5 problem, I don't know, because it's so important. I mean, people are saying there's too many people on the planet, we have climate change and stuff like that, but this is just not true anymore for the Western world. I mean, the birth rate is declining spectacularly and still does. So this should be on our agenda for all the politicians, and it is just not. So this is insane, and we should do something about it.
Thanks. Chris.
Just a closing comment that goes back to social policies, social awareness is if with the data that are showing the connection between reproductive and somatic health, this means that there's also an impact on the healthcare system. And so early diagnosis, or better, prevention, there are opportunities there that presently, at least here in the States, are being missed. And so prevention, treatments can start earlier if men participate earlier in healthcare seeking.
Great, thank you. We've come to the end of the time on the panel, so I want to say a warm thank you to Chris, to Benedikt, to Mariana and Klaudija. Thank you for sharing your perspectives. We're now going to take a short 5-minute public health break where we encourage you to get up, move around, go to the bathroom, get yourself a water or coffee. And we'll start again in 5 minutes at 2:05, and then we're going to be looking at where we go from here and how we ensure equitable access to fertility screening and treatment across Europe. Thank you all for participating. Thank you, panel, and see you in a few minutes. Good afternoon, everybody. Thank you and welcome back. In this second session, we're going to be looking in detail at how we address this, how we ensure equal access to fertility screening and treatment across Europe. But just let me reassure those of you who found the earlier presentations extremely helpful. There will be a video of this session The PowerPoints will be made available in PDF format for you, and there will also be a report of this webinar, so you'll be able to use the material and share it widely. So thank you very much for your interest, and we really found it useful, the very active participation of participants. All your questions were helpful, and we're going to do the same thing. We have 2 short videos from members of the European Parliament who've got a particular interest in supporting our issue, and then we'll have a number of panelists and we'll have a Q&A session. So if you have questions or comments you'd like to bring up with our panelists, please use the Q&A function. But now let me introduce the 2 members of the European Parliament who have kindly recorded short videos. We have Francesca Fitzgerald and Bartosz Arłukowicz from Poland. Let's start with Frances's message.
Hello everybody, and thank you for having me join you for European Fertility Week 2021. The topic of your conference today is one of the more unexamined aspects of fertility in Europe today, male infertility. The topic of female fertility, of course, and its causes such as age and endometriosis, amongst others, has been increasingly more discussed, thankfully, over the past number of years. However, male infertility remains more of a taboo. As such, I'm delighted to be able to join you today to discuss the topic further. First of all, I think we need to do more to facilitate this conversation. And as with all outreach, we have to go where men are to start building on the conversation. In workplaces, at sports events, at concerts, in restaurants and bars. We need to facilitate this conversation and be open about what are very painful realities. As we have begun to open up on mental health and to work with men to have these conversations, so too must we do the same in regards to male fertility. While it comes to making advances as regards our knowledge of and treatment for male infertility, I strongly believe that the European Union can support and contribute to this effort. Through our Horizon Europe programme for research, the EU can facilitate and work with educational institutions and research bodies to learn more about male infertility and what breakthrough diagnosis can achieve, and breakthrough diagnostics actually. I believe that this is closely related to the EU's existing work on the European Green Deal and our progress towards a cleaner and less polluted environment. When I worked with your host today, Fred Matic, on his report on the situation of sexual and reproductive health and rights in the EU, we included an important call to consider the impacts of environmental changes on SRHR and fertility, included but not limited to water and air pollution and an increase in the consumption of chemicals. Asks that this be further examined through Horizon Europe and addressed through the European Green Deal. We must follow up on that call for both male and female fertility and for our demographic situation as a whole. In the bigger picture, we know that Europe is in a demographic crisis. People are choosing to have children later or not at all, and we know that the later people choose to have children, the less likely they are to conceive. Without a sustained population growth, our Europe will experience significant and system-altering challenges. For example, pension systems running dry, a lack of labour to cater for an older population, and a continuously vicious cycle of a lack of children born. Therefore, it is in all governments' interest to make fertility treatments widely available to the population as a whole, and indeed the supports that are needed for family life, such as childcare and affordable housing. We have seen governments financing fertility treatments in certain member states, but not all. We must continue to work with them to stress the existential importance of such funding. So allow me to finish by thanking Fertility Europe and my colleague Fred Matic for hosting this important event during the very appropriately themed European Fertility Week. Wishing you the best of luck with the remainder of the event and hope to see you all again soon.
Thank you to that message from Frances Fitzgerald. And now to hear from her colleague, Bartosz Arłukowicz from Poland.
W Polsce około 1,5 miliona par boryka się z problemem niepłodności. Część przyczyn leży po stronie pań, ale też duża część przyczyn leży po stronie panów. Zmiany środowiskowe, siedzący tryb życia, to wszystko nie sprzyja płodności. Do 2050 roku problemy z płodnością może mieć około 40% mężczyzn. Dlatego badajmy się, panowie.
We have two very strong messages from members of the European Parliament who see the perspective both in terms of individual families, but the broader perspective over time, the impact of chemicals and other environmental impacts, and what this means for Europe's demographic situation and for its population. So clearly the European Parliament understand the perspective of male fertility and infertility with the broader perspective of reproductive and sexual rights and health. Let me now introduce our panel, because we're going to move into this issue of how do we ensure equitable access to fertility screenings and treatment across Europe for all. And here we have our panelists. We have Deirdre Fahily from the European Commission, from the part of the Commission that deals with something called substances of human origin, and she'll tell us more about what that means. We have Csilla Krausz, who's the president of the European Academy of Andrology, and she'll tell us what andrology means, because we had that as a question in the chat. We have Calhaz-Jorge, the chair of the European Society for Human Reproduction and Embryology, and we have Neil Datter, the secretary for the European Parliamentary Forum for Sexual and Reproductive Rights. And they're going to be addressing this issue of how we ensure equity in access to screening and treatment. Let me start by introducing Deirdre from the European Commission, and you're going to particularly give us a connection to a piece of legislation at European level that's currently being revisioned, and it covers blood, it covers human tissues and cells. So Deirdre, the floor is yours.
Thank you very much, Tamsin, and a big thank you to Fertility Europe for this opportunity to join this really important event and tell you a little about the work we're currently doing on EU-level legislation that does impact on this field. As Tamsin mentioned, it's a set of legislation that covers blood, tissues and cells. In fact, the general concept is that it covers substances that are sometimes donated or taken from one human person and used to treat another. And we actually have legislation in this field since 2002. Now, I must immediately say that the legislation does not cover all of the topics you've been discussing and will continue to discuss today. We have, the member states have given to the EU a certain legal competence to legislate in this field, and that is limited to areas related to safety and quality. So issues, not all issues, so for example, issues of the healthcare organization or any issues to do with ethical aspects of the provisions of these services are not within the remit of European legislators. That's a member state level issue. However, wherever a member state does allow or promote a certain kind of service for patients, then the safety and quality of the substances that are donated, stored, processed, prepared, and used for patients is then covered by this legislation. Of course, legislation isn't the only tool we have in the EU. As you've already heard from the MEP Frances Fitzgerald, we also have the public health programme now called EU for Health. And we also have the research programme now Horizon Europe that can really contribute to this area. But I'm going to focus very specifically on the legislation because of this current revision. Next slide, please. Thank you. The legislation, as I mentioned, is rather old, and we conducted a full evaluation of it published it in 2019. And it raised a number of issues. I mean, some very positive ones about the impact of this legislation on the health and safety of patients and donors in the EU, but it also highlighted 5 major shortcomings, and you will see when I explain them to you that a few of these are quite relevant to this field. First of all, it found that the patients are not fully protected from avoidable risks when they're treated with substances such as blood or tissues, gametes, or when an embryo is implanted, because the technical rules that we have for safety and quality are not being kept adequately up to date. This is a difficult thing to do with epidemiological changes, scientific and technological changes occurring so frequently. So this was an issue. The second one was that the focus of the legislation currently is on protecting recipients, those who receive the substance in their body. It does not emphasize risks to donors of substances of human origin, including gametes, or indeed the safety of children born from donated eggs, sperm, or embryos. So indeed, if a child is born with a genetic condition that could have been avoided, that does not even currently require reporting as an adverse occurrence at the EU level. The third problem related to different ways that the member states have implemented the legislation in their member states. And the result of that has been that sometimes barriers are put up between member states to the sharing of these substances. So it can be that sperm that's stored in a sperm bank in Denmark, for example, cannot be shared for patients in one of the other member states because that member state has a different approach to regulating that field, and therefore has some different standards that have not been met in the bank in that country. So this is an issue we need to address. And the fourth one is that there has been a lot of innovation, the ways of processing, the ways, of course, of fertilizing egg cells in the laboratory have really developed. The ways of storing egg cells, of storing embryos have really changed over the years. And we need a better means of showing that demonstrating that those new methods are indeed effective and work for patients. And the final one is to do with interruptions in supply, access generally. And we've seen even highlighted, of course, through the pandemic, that indeed these fields can be very much susceptible to interruptions of supply because of various crises, and that's something we need to address in the future. Next slide, please. Just to say a few words about the process. So we're following a set of rules we must always follow for the EU, where we've published our roadmap. We've conducted 2 consultations online. We have 2 ongoing studies gathering evidence being conducted by independent companies. And we are now assessing the impact of a series of policy options that we published at the beginning of this year to try and address all of those issues. We plan to publish the results of that impact assessment and our new legal proposal by the end of this year or early next year. That's the current, that's where we are currently. And you can follow this process at this website address. Next slide, please. Just to say a few words about the public consultation, we had a very high rate of response. Big thanks to Fertility Europe, who were active in that process. For the open public consultation, 214 responses from all across the EU, and 160 to a targeted consultation where we targeted organisations active in the field. This was a high response, and we were very pleased with the wide geographic distribution and the different types of stakeholders that responded. Next slide, please. We published a summary of the outcome of the open public consultation, and I'll give you the link at the end where you'll see that. Next slide, please. Just to mention a few of the issues, we had then a series of focused workshops, 14 workshops in all. And I just mentioned here 4 of them that were of relevance for this field in particular. We looked at how best to keep technical rules up to date, whether it should be by putting them in legislation, by letting the professionals set them, or by having references in EU legislation to technical guidance updated by expert bodies. We looked at how oversight is working from the authorities' perspective, and we looked at how it's working from the operator's perspective, those giving the services. And very importantly, we did a dedicated workshop on donor and offspring protection in the field of medically assisted reproduction that came with some very important findings. For example, it was concluded that an EU register of donors was essential in order to protect, to monitor the health of egg donors, for example, and to monitor the frequency of donation of sperm by male donors. strong conclusion also was that genetic testing and genetic matching for gamete donors was going to be very important in future legislation, and that we need to have rules on the frequency of donation and compensation for donations. And it also came out there that the use of expert bodies to set technical rules was the preferred one. Next slide, please. Finally, this is the link where we are keeping the information up to date as we go along, and you can follow the process there. And we would really, I hope you do that to make sure we really want to ensure that the future legislation does everything it can to improve services for donors and for patients in this field. Thank you very much, Tamsin, and thank you to Fertility Europe.
Thank you, Deirdre, for giving us this insight and how the area of fertility fits in this bigger picture of a legislation that addresses blood, tissue, cells, everything that comes from a human origin. And thank you again also for a specific workshop addressing the offspring of donations, because I think that's quite key, a new emerging area that those perspectives is taken into account. Let me now introduce the next member of our panel, and a reminder, just like in the first panel, please, if you've got a question or comment to any of our speakers, put it in the Q&A so I'll have a chance to bring it up when we move to that section. But Csilla, you're the president of the European Academy of Andrology, and we had an earlier question, what's the difference between a urologist, an andrologist, a proctologist? What are all these specialities and how do we navigate through them? And I'm sure you're going to give us some insight. Go ahead, Csilla.
Thank you very much, Tamsin. So first of all, I would like also to thank the organizers, the Fertility Europe, for giving me the opportunity to talk on behalf of the European Academy of Andrology. If I may have the next slide, please. So the question is, who is the andrologist? First of all, I would like to say that many of us are female doctors. So there is absolutely a very 50-50% gender distribution. So this is a specialist of male health. It's a little bit like, the female goes to the gynecologist. The problem is that male is not so easily going to the andrologist. So the andrologist, next slide, please. So the andrologist actually is a specialist, is a doctor who can be either an endocrinologist or urologist or gynecologist, in some country even dermatologist, who are expert in male health related problems. And since andrology is not very well known to the general public, last year the EAA, we decided to open a web site called Andrology Awareness EU, in order to give evidence-based information on health-related problems. As you can see here, I made some screenshot, and we give advices. And also the most important advice is please go regularly to seek an andrologist. And why? We already heard about it. The next slide, please. So the reason why is, as Chris mentioned, that we have plenty of diagnostic tools. It must be an expert who prescribe what you have to do to reach to the correct diagnosis. And this correct diagnosis will allow or implies that we can actuate preventive measures. Now, for instance, if we take erectile dysfunction, it can be due to different causes. If it is a vascular, because we made the right diagnosis with the right diagnostic tools, then that can be a sign of a heart problem, coronary disease. If we identify a genetic factor causing male infertility, that could be transmitted, so we can apply, we can advise to the couple to perform a pre-implantation genetic diagnosis. If we have the correct diagnosis, there will be the most appropriate treatment option, and not always IVF. So we can really make a choose. Another issue raised by Chris is the relationship between male reproductive health and general health. So sometimes when we perform the diagnostic workup, we come across to some diseases which are important for the general health. Like we know that azoospermic men are at higher risk for testis cancer. We know that there are at-risk group for prostate cancer. So if you go regularly to the andrologist, then you can pick up earlier these diseases, and that means a much better prognosis. The early intervention in hypoandrogenism is also very important. So, okay, everything is I think it's quite convincing. Now the problem is, the next slide, please. The problem is how many andrologist experts we have in Europe, because how do we educate doctors to become andrologists? So first of all, in Europe, there is no global recognition of a subspecialty of andrology. And the only organization which takes care about training clinical andrologists is the European Academy of Andrology. We have 27 EA accredited centers all over Europe, and one in, as you can see in the map, one in Los Angeles and one in Cairo. But what is disappointing, if you look, I don't know how much you can see, but the map shows that there are some countries where there are no training centers at all. So since we are talking about equity, how to access, how to have an equal access to specialists, unfortunately, despite the 27 centers, we are far away from equity. So the next animation is just to say that it is still not enough what we have. I am happy to say that last week we had a kickoff meeting of a cost action. This is the EU supported cost action called Andronet, which is collaborating with the European Academy of Andrology, and our common objectives, and I think the common objectives can come out also from this panel with ESHRE, with Fertility Europe, to really try to increase the number of training centers to have a standardized and highly qualified education in this field. So with that, I would like to thank you for your attention.
Thank you, Csilla. And we've already got a couple of questions coming in from the audience for you, so I'll bring them up when we have the Q&A section. Let me now introduce the next person who's going to speak, and that's Calhaz-Jorge from the European Society for Human Reproduction and Embryology, also known as ESHRE. And you are the partner in the shadow. How can you help? We've talked about some of these huge challenges, the invisible problems, some of the issues of the shame, the taboo, the stigma. Where's your role in helping with some of these issues?
Thank you, Tamsin. I'd like to congratulate Fertility Europe board for this initiative. It's my pleasure to be with you today. I cannot answer how to solve a cultural and deep individual and social problem. The partner in the shadow was clearly highlighted before by Marianne and by Chris, by Benedikt, because we have in cultural differences, we have people that feel shame by having, at the end, having a disease, because infertility is a disease. So it's not up to professional association like ESHRE to solve such a big problem, but I hope we can help mainly in the broad scope of education. That's one of the aims of ESHRE. Please, the other following slide. Yeah. So I divided in 4 subtopics what we are already doing and what we can try to do to help. Next, please. So as a professional association, as I said, focus on our main aim is to promote the interest and understanding of reproduction, biology, and medical dimensions. So we have already in our organization by special interest groups, we have already one of andrology, and of course one of psychology that can help also. We organize technical workshops and courses devoted to increase the knowledge of our members and the clinics in general. We have devoted 2 of our research grants to the andrology field in 2020. So this is for us, of course, not an unexpected topic, and it's a huge interest in MRHI. The next, please. What we are already doing as well is supporting some initiatives, supporting Fertility Europe since the beginning, supporting a reproductive male health initiative that Chris talked about, supporting another initiative of education, the International Fertility Education Initiative. So we are already involved in supporting education in the broad sense, but we are aware that the other 2 subtopics are not really directly connected with our possibilities. Next one, please. Because infertility awareness campaigns and education for health are for sure more in the field of policymaker involvements and of, I would say, other kind of structures. All of us know that awareness campaigns are very long duration or need to be long duration projects, otherwise they will not succeed. And even to define success is a quite difficult issue. The next one, please. And education for health must begin in school, as was already said. We need that young people be aware that their lifestyles are contributing for their health or non-health since the beginning. As was said already, reproductive health education was mainly focused and is mainly focused on contraception and IST, but reproduction in the fertility dimension needs to be addressed also, and not only for young girls, but of course also for young boys. We know that many of course, alcohol, smoking, but even soft drinking is involved with the quality of sperm in the future. So we need to be aware that educational projects in EU level or the involvement of the European Parliament, as I'm happy to see that some of the members are aware, need to be involved and are far from MRHI capacity except to contribute. And we are involved in many projects at the several organizations and structures of EU. So I'm sorry to say that MRHI is not in a very good position to contribute to the equity of the access of to fertility screenings and treatment, because this is more at the national level. But we are aware of that, and we are keen to contribute as we can. And thank you for the opportunity to be here and share this with you.
Thank you, Carlos. And as a reminder to our audience, if you have specific questions for the members of our panel or you'd like to make a comment, please use the Q&A function at the bottom of your screen, and I'll bring those questions in a moment. Our final panel member is Neil Datta, who is the Secretary of the European Parliamentary Forum for Sexual and Reproductive Rights. And of course, this panel is about addressing equity issues across Europe. So what's the perspective that you can share with us?
Thank you, Tamsin. First, I just want to say it's a pleasure to be here with you, and I'd like to thank Fertility Europe and MEP Fred Matic for organizing this very important event. Just a few words about my organization, EPF, European Parliamentary Forum for Sexual and Reproductive Rights. First of all, we are a network across Europe of legislators, secondly, who want to improve sexual and reproductive health and rights. So this means mainly contraception, abortion, maternal health, etc. In relation to this discussion, what this means is that I find that there's been almost a double blind spot in the field of sexual reproductive health and rights that some other speakers have alluded to, in that in talking about reproductive health, we focused on two areas, or we have neglected two specific areas. One of them is that we have been focusing so much on preventing pregnancy. We haven't been looking at those people, those women who want to have a child. I mean, and there's very good reasons for this. Around the world, there's a large unmet need for family planning, and mainly in the global south, but we haven't looked closer to home here in Europe. Secondly, so much of reproductive health or sexual reproductive health focuses on women, and very understandably and rightly so. But what this means is that there has equally been a blind spot on men. And so with this double blind spot identified, I think really it's very notable and praiseworthy to see that that MEP Fred Matic has so clearly included fertility in the report on sexual and reproductive health and rights adopted earlier this year. It's one of the first big policy documents at EU level that anchors fertility within the broader discussion about sexual reproductive health and rights. I want to make 3 points now. First is within the context of male fertility and sexual reproductive health and rights. One is about men. So this has been said by a number of speakers earlier, but there has been insufficient focus on men, and specifically on their psychosocial support needs and needs. And then also in terms of actual fertility treatments, so that even when the cause of infertility is found on the male side, the treatment is often on the female side. So I think there needs to be more exploration of how this can be addressed. And next point I want to make is that about fertility awareness. It's been said by some of the earlier speakers, although being the last speaker, I think I have the dubious honor of repeating what some others have said, but about fertility awareness. We've heard earlier about how Europeans in general are having their children later on in life. This has several implications for overall fertility. If one has a child later on in life, one will have fewer total number of children. There's also a lack of awareness of some of the different modifiable factors in our own lifestyle that then influence our overall medium or longer term fertility. And these things need to be addressed in one for our own benefit, but also in relation to what Francis Fitzgerald, the MEP who presented the video, mentioned, and that's in terms of the concerns around demography and specifically demographic decline that's taking place in many parts of the European continent. And this is one area I want to take a look at, also the third area, which is demography is a very valid issue in and of itself. Many countries in Europe, and specifically in Central and Eastern Europe, are experiencing real demographic decline, so that within the next 20 to 30 years, some countries can expect to lose 5, 10, 15% of their population. And as the MEP pointed out, this poses real questions as to who will pay for our pension systems. You know, how will we organize our country with that many fewer people? And it's in part for this reason that the European Commission has created a new position within the European Commission, that of a vice president in charge of democracy and demography. And so this is the first time that the European Commission will be taking a look at this issue. And there, I think we need to see how it is that we can situate questions of fertility within the overall discussions about demography. And this, we need to overcome this lack of fertility awareness. But within this lack of fertility awareness, there's a certain vacuum of knowledge around this. The vacuum is being filled by some of the wrong people. So that what we see are some of the actors taking the issue of demography on board are some far-right, alt-right actors who notice that there is a demographic decline, and then offer very simplistic and very archaic solutions, so that if we have this many fewer people in our country, the best solution is to restrict women's rights to access contraception or abortion, and then we can mathematically have that many more babies in our country and our nation will prosper. I think there's many scientists on board or people with academic backgrounds on board this webinar. So I think everyone will recognize that it's not as simple as this, but it offers very appealing and easy to understand messages. So I think we need to see about how it is that we can address this vacuum of fertility awareness, not just for the benefit of the people who are undergoing infertility, but also to preserve broader human rights. So just to conclude here, I think I'm at the end of my few minutes. It's important to situate fertility and infertility within the broader sexual reproductive health and rights debate. We need to place more focus on men's role in fertility within sexual and reproductive health and rights as well, and then overall men's health. And then also promote fertility awareness for its own sake, but also for the sake of human rights and for policymakers so that they make the right decisions on fertility, demography, and overall health. So thank you very much.
Thank you very much, Neil. And again, you've brought in an additional element to our conversation, which is the extent to which fertility generally is politicized in some ways, and that there are some arms of the political spectrum that they see this as an issue where they, the state, should have a role in control, and that the answer, if there are fertility drops in fertility, then their answer is to control women rather than provide support for the families and the people that want to have it in an appropriate way. So as you say, we're navigating in some very delicate issues here. I'd like at this point to bring all the members of my panel up on screen, because we're now going to look at some of the questions that have been submitted by our audience members. So thank you for joining. And I think, Deirdre, if we can bring you back as well, if you can pop your camera on as well, because we have a question for you as well. Let me start with you, Deirdre, because there was a very simple question I think you'll be able to answer immediately. Is there an awareness campaign planned for the revision of the Blood Tissues and Cells Directive? And I would guess, given that you've just had a big public consultation, the answer was yes, it's happened. But let me invite you to answer that one.
Yeah, yes, Tamsin, I think you're right. We're really at the stage of the analysis of the policy options and looking at what the stakeholders have thought. We've had really huge degree of interaction with stakeholders of all different kinds, and it's been wonderful to have the patients represented in that process. But we are coming to the end of that. But of course, as soon as the Commission proposal, the legal proposal, is adopted, it then goes on to be discussed in Parliament and by Council, and there will be many other opportunities for communication on this issue. We're always open to bilateral meetings with organisations like ESHRE, like Fertility Europe, and we have had them in the past. So any major issues that come up, there's always an opportunity to come and talk to us about them.
Thank you. Carlos, let me bring in, there's a couple of questions to you about the role of ESHRE. And of course, you said very clearly that ESHRE can't fix all of the problems and can't address all of the big public awareness issues. But we've got a question here about whether you are, with your member organisations and professionals, whether you support or deliver communication skills education precisely to be able to communicate on some of these very tricky, very intimate, very sensitive issues with patients.
Thank you for the question. Of course, we have one of our special interest group is global social cultural aspect of infertility, and is included in its aim also to collaborate with other initiatives. But initiatives coming from ESHRE. ESHRE is supporting, as I said since the beginning, Fertility Europe as our link to patients, and in all guidelines and technical papers, guidance, we include always a representative of the patients, and we always have a version to the patients, a simplified and adequate version for the patients. But that's our work at that level.
Thank you, Carlos. Csilla, if I can bring you in, because we've got a couple of questions here for you. First one is, do you tell when you treat patients, do you tell them about psychological support or patient associations? Do you help drive them in the direction of organizations that might help? And we heard from the first panel how much power they have. And secondly, somebody asked what the European Academy is doing in terms of filling the need for new diagnostic approaches, because the WHO says we need to be able to understand more about, how to diagnose and treat male sub and infertility. What is your network doing on that?
Okay, so the first question, whether we have a psychological, whether we address our patients to psychological support. Of course, if we perceive that the patients have, at least during our visit, if we have the feeling that there is a need for it, there is a possibility. This is, I can say what we have in Florence, but I think in many other centers, there are always psychologist team available. But I think that we should really increase the number of expert psychologists for this specific condition, for this specific problem. So certainly one of our future priorities is also to attract psychologists to our organization, because then it's easier to learn from them and they can also learn from us. So many thanks for this question, because this is a part of our work that is not very well yet addressed. So it's something that we have to work more on it. Concerning whether the EAA can give support, yeah, we give, for instance, we had a multi-center study on ultrasound diagnosis. So that was a diagnostic test. We standardize now the diagnostic values of ultrasound measurement of the testis, scrotal, and the prostate. So we did finance such a study. For the moment, we do not have any plan for diagnostic test in semen, but of course we are open to, if somebody become a member of the EAA, has a right to propose it. So thank you.
Great, thank you. Neil, let me pick up an issue with you, which hasn't come up explicitly yet, but I'm wondering if it's an element. We've spoken about the sort of gender mismatch in terms of women are health seekers of information and will go more regularly to their doctors rather than men. But we've also heard that there are about 50-50. Csilla said that the andrology community is 50-50 men and women, and we know also that the obstetrics gynecologists, they're also male practitioners or not. But men or women get directed to one or the other. But I think we're also missing a gap, which is that we are no longer in a society that necessarily sees itself as gender being binary. There's a whole range of fertility treatment and support that is needed for people from the non-binary community that, and I'm talking transgender, intersex, and others who will also be needing support. I mean, where do they go to? Would they be going to the andrologist, to the gynecologist? To what extent do you see in your overview of the parameters of reproductive and sexual health rights, this community, and making sure that, that if we have andrologists that deal with male health, we have gynecologists that deal with women's health, but where do we fit in this spectrum that's increasingly fluid? And that's a gap, surely.
Yes, thank you, Tamsin. I think you're quite right. That is a gap. And I have to say, it's a gap I experienced myself. So I don't have expert knowledge to share. I can simply share with you an anecdote. And that is that a previous president of our organization was herself a transgender woman who she was first a senator in Belgium and then became a member of the European Parliament. And in her non-political life, she was a gynecologist who also helped with surrogacy treatments. And she's now Deputy Prime Minister of Belgium. Her name is Petra de Sutter. Okay, and what I remember her saying at a medical conference was that in terms of transgender health, basically you have to treat the patient for the physiology that they have, not necessarily the gender that they identify with. And so I think perhaps that's a small indication of where it is that the non-binary transgender patients should be oriented to. And I believe that the medical profession will be orienting them in the same way.
Thank you. Csilla, would you like to, Csilla and Carlos, can I invite you to pick up on some of that issue? And also we've got some questions from the audience saying, how do men react when they realize the doctor is the woman? Is that easier or more difficult? And, you know, do fertility clinics include men sufficiently in the process early enough? So perhaps you might like to comment on those. Csilla, would you like to go first?
Yeah, thank you. So no, I think it's, I'm doing this job since especially when I have been 1995, let's say, when I finished endocrinology. So yeah, at the beginning it was a little bit a moment of crisis, but then at least in our society, I think that andrologists, women are so many that men, when they come, they have no problems at all. On the contrary, sometimes they say that they prefer a female doctor because we have more empathy and we have a kind of, you know, more nice way to approach them. But apart from this, no, we do not experience any problem. At least I can say what I have here in Florence, where I am working, and also through talking with other colleagues. Concerning the IVF centers, I think in Italy we are again lucky that there is a law that actually in each IVF center there should be an expert in andrology. So the best way would be if there would be an andrologist with the subspecialty, because that would be the perfect way, and to act together. So to have the gynecologist, the andrologist together in front of the couple and to start to solve together the problems. So this is what should be done.
Carlos.
Yeah, thank you. Now I'm talking as a clinician, not a representative of ESHRE, of course. In my long clinical life, I faced everything because the relationship between patients and doctors are individual. So there are people that feel more comfortable with men, and there are females that don't want a female doctor, and vice versa, that everything is possible. So that depends of the people involved and not of the sex of the people or the gender of the people. Regarding the clinics, I think that there's huge difference in Europe as in every field of our specialty. So there are countries where urologists with special differentiation or andrologists are mandatory in the clinics, but there are countries where they are not involved. UK, I know that many clinics have no andrologist, but of course they have quality of clinical care. But that's just to represent that the equity is not the real world.
Okay. We've come to the end of the time for this panel, and I'd like to say a warm thank you to the member of the panel. So that's to Csilla, to Deirdre, to Carlos, and to Neil for sharing some of your perspectives on where the gaps are in equity and how we can create a more balanced and accessible and inclusive environment for men and women to access fertility treatment in Europe. So thank you very much. And now I'd like to hand the floor to the people who started our conversation, and that is our host, that's Predrag and Matic, the member of the European Parliament, and Satu, Rautakallio-Hokkanen from Fertility Europe. We've had a great conversation, really broad, wide-ranging, very interactive with the audience. Where are we now? Fred.
Thank you, everyone, for the expert inputs and the discussion behind it. From everything we heard today, I can conclude a few key points I'm taking away. We need to destigmatize this topic of male infertility. Unfortunately, in today's society, it is still somewhat a taboo to speak of infertility in general, but specifically of male infertility. We, as a man, are taught not to address it and discuss, that we have to change urgently. This is a medical issue and needs to be approached as such with no discrimination or stigma. We need to push for more comprehensive policies in the area on infertility. This also bearing in mind that we need to allocate relevant funding to expert research and healthcare policies which will follow the recommendations of experts. I can only say that for me, this was extremely insightful today, and I will use the data and findings we discussed in my future work. In that, I hope that I can count on your support in order to address this more comprehensively on the political level and together achieve what we all advocate: full access to fertility treatments. Once again, many thanks to all participants, and special thanks to you, Tamsin, for the great moderating today's event. Thank you.
Thank you. Satu, let me pass to you for the closing words.
Okay, well, I have to say this has been an excellent and inspiring 2 hours of information, experience, and discussion, so thank you very much. It is clear that this discussion needs to continue. Infertility is still an invisible problem that causes isolation, mental health issues, and stigma. And like we've heard, men don't know how to get support, and unfortunately, in many countries, it's not even available. So we call the decision makers and politicians to change this with ensuring for all those who need help with their fertility problems, safe, efficient, non-discriminating treatments, screening and healthcare checkups, and psychological support. This way, we can empower men and women to gain greater control over decisions and actions affecting their health. For the general public, our message is that there's nothing to be ashamed of when you talk about fertility and infertility. Talk openly with your family, your friends, your colleagues. If you don't know how to support someone who has problems, then advise to reach out to patient associations. They are there to help. Fertility Europe will continue this discussion beyond the European Fertility Week for sure. Our next steps are to publish the Atlas map of Europe, where we will search for the perfect country. The aim is to build greater awareness among decision makers of the need to take actions and remove the inequalities in the access to fertility treatments across Europe. Together with the European Parliamentary Forum for Sexual and Reproductive Rights, and Neil being one of the major people in that, we will create a map of all European countries, color coding the quality of access to fertility treatments in each country. It will be published on the Human Rights Day, the 10th of December. And like Mariana mentioned already here earlier, with the kind collaboration of ESRE, Fertility Europe also started this summer a 3-year project about fertility awareness, where we start educating digitally young people aged 15 to 18 to check their knowledge of fertility and to raise their awareness level. It's obvious and of crucial importance that the level of fertility awareness should be increased among the teenagers. It is time to say thank you to our wonderful host, Fred Matic. Thank you very much, who has been supporting us and our course and is continuing to do that with the Atlas map. Huge thank you also to our wonderful speakers who have used their time to join our event and give their expertise. Special thank you to Ben and Tom for being a great example of talking about male infertility openly and in public. Thank you to Josef for the technical help with the event. And thank you very much, Tamsin, for taking us through this event smoothly and professionally, as always. And thank you to the audience for watching and participating in the lively discussions. If you have more questions to the speakers, or if you want to be more engaged or more information about Fertility Europe and our project, then please contact us. You can find our contact details from our website, which is this.
Thank you, Satu. So I think it just leaves to me to say a warm thank you to everyone. And you will, as I said, there will be a report from this event. There will be video clips And the PowerPoints will be shared in a PDF format, so you'll be able to take some of the data and use it in your advocacy work. So thank you all for participating, and see you again at another event for Fertility Europe.
Thank you, everybody.
Bye.
Bye.
Thank you.
Bye-bye.
Bye.
Bye.